Good afternoon, everyone, and welcome to the monthly NASW Pennsylvania Chapter webinar. My name is Joanna Bird, and I'm your host for today. This free webinar series is done as a member benefit and is available to NASW Pennsylvania Chapter members only. Webinars are done each month on the last Wednesday of the month at 12 o'clock p.m. and count for 1 CE credit each. During the webinar, when you have questions, type them into the questions section on the menu on the side, and we will have a couple of times throughout the presentation where we'll break to accept questions. Following the webinar, to obtain your your full CE credit, you must attend a minimum of 50 minutes. Following the webinar, if you attended that minimum of 50 minutes, you will receive an email with a link to complete the evaluation. The link will be posted to the chat section near the close of the webinar. The certificate will be sent to you via email in a few days. And note that that is a few days, that our certificates are not automatically generated or anything like that, but one of our staff members has to fill in each of your certificates, and so it will be at least a couple of days. So please allow that long before you contact us to say that you have not yet received your certificate. With all of that said, I would now like to introduce our presenter. Kayla Schubert-Worth has her BSW and MSW from Kutztown University and is an LSW and a CBIS, which stands for Certified Brain Injury Specialist, which of course makes her very qualified to talk about our topic today. She currently works at Valley Youth House, providing in-school short-term therapy to students in grades K through 12. Thank you, Kayla.
Hi, everyone. I am sharing my webcam. I don't know if it's going to be up yet. I know yesterday when we were testing it, it did take a couple seconds to kind of go through, so hopefully you will see me in a little bit. But welcome and thank you so much for joining me for this presentation on concussions. This is something that I really, truly am very passionate about and want to educate social workers and really just everyone about, because it's something that is so important. Because it's something that impacted my life personally. And I'm going to share that with you because I think that hearing a personal story and getting a connection with that, it resonates with us a little bit more. So I'm going to kind of start with this for you guys. So this is kind of my journey. And I like to say it's my journey because I'm still going through my journey today, right now still. So growing up, I played numerous sports throughout childhood. I did karate at the age of 5. I played basketball. I played Division II basketball as well for a year in college. I played field hockey. I was always really active. I had 2 documented concussions in high school. So basically, one, I was playing in gym class and I got taken out during flag football, and another one in field hockey. Minor concussions. No really symptoms or anything like that. I was back and ready to go on the next day, and so forth. And then in grad school, I was going to Kutztown for my master's in social work, and I was walking into a school because I was working, and I walked into a school, and snow and ice fell off a roof and it hit me in the head. I didn't lose consciousness. I didn't pass out or anything like that. But I kind of was just like, what the heck just happened here? I immediately got obviously taken into school, and they called the ambulance because I said my neck hurt. When I went to the emergency room, they said nothing was wrong with me, but obviously something was really wrong with me. And this was in February of 2014. I was in an accelerated master's program. And as any of you who have been through an accelerated master's program went through, it's hard. There's a lot of emotions, and it was kind of at the end of this process for me. I was really struggling. I really don't remember kind of the next couple days, and I still don't. And I ended up going back to class, and I'm sitting there, and I was talking to my professor, and we were kind of figuring out what to do. And I was like, oh yeah, I'm going to do it. I'm going to push through this. I'm going to graduate. And that night I went home, and I remember this, and I'm writing a paper because, you know, you're in school and you write 5 papers at a time. And the next thing you know is I'm holding my head and I'm shaking and I'm crying. And I'm living with a family friend at this time, and she saw me write 2 papers the week before, literally in 5 hours. And she was like, whoa, something's not right here. So at this time, she was like, Kayla, we need to go to the emergency room because something's not right with you. And then I agreed with her. So we went to the emergency room, and they're like, hey, you have a concussion. And I was like, okay, cool, it's a concussion. But this kind of changed my life, for sure. So basically, this was under workman's comp, of course, so I had to stay within network for the first 90 days, and I had to see doctors, and they just kept giving me medications, and of course I was taking them. I was driving to Kutztown. I took some time off, and I kept calling my one professor, Dr. Gasker. I hope she's on here because she'd be laughing right now. And I had my capstone due, and I was so worried about getting this part of my capstone in. And I kept calling her and calling her and calling her and calling her and emailing her. And I probably called and emailed her probably about a good 20 times. And she finally answered. And she says, Kayla, why do you keep calling me or emailing me? And I said, because my paper's due. She says, Kayla, what's going to happen if you don't submit this stuff? And I said, I'm going to fail. And she says, exactly. She says, but what's more important, you failing or your health? Whoa, my health is. So her and I agreed, and she told me that if I submitted a paper, she was going to fail me for the year. So that immediately kind of put me on hold, and I was like, whoa. So I kind of stopped there for a little bit, and kind of, I didn't do anything. I stopped, and I didn't go to class for about a month. I did go back to class for a little bit, and I remember sitting in the front of the classroom, and we were talking about something, and we had to do a small assignment, and no one knew I was crying in grad school in the front of the class because we had to do an assignment, and I couldn't focus to do the assignment, what we had to do. And that was heartbreaking for me because I was an advanced standing graduate student crying in the front of the room because I could not focus, let alone read what was in front of me. That was heartbreaking and devastating for me, and no one knew what was going on around me. So this pretty much went around from February. My symptoms pretty much stopped in May, or I thought they stopped, so to say. And then I want to say in July, my symptoms came back full force. I hid them pretty much from everyone because I'm very good at hiding things. Excuse me. And I started telling my one coworker who I went to grad school with, and he said, hey, you need to tell the supervisor. And luckily, where I worked at Valley Youth House, they were very open and aware of this because this is where I interned at and I was working at. So they told me, hey, go seek help. And luckily, the executive vice president told me to come with her to a training on concussions, and I went with her, and I cried the entire time. So they talked about something called post-concussive syndrome, and I was like, that is me. And I immediately went to Lehigh Valley Health Network, and I got an assessment done, and I started getting OT and PT to kind of work on all the deficits that were going on with me. And they wanted to immediately take me out of work. And of course I was like, you can't do that. I just graduated with my master's degree and I'm a licensed social worker and I want to save the world. You can't do that to me, no. So then I was going through that. I had a really hard time there because I felt like they were just treating me like a person with a concussion. They weren't treating me kind of individualized, which was very hard for me. I actually was put on timeout a few times because my mood swings were really bad, and so forth. And then I ended up going to another program called Good Shepherd, and I was placed in OT, PT. I had a neuropsychiatrist. I had a neuro-ophthalmologist. My workload, he made me pretty much said, I'm either taking you out of work or I'm reducing your hours, but you're not working full time because you cannot. And then I was going anywhere between 6 to 15 therapy sessions a week. This was a really hard time for me. I just started to share with this recently with friends and family that I was suicidal during this time. I remember driving down the road and thinking that if I run my car into the median, I would kill myself. And I'd be like, oh my God, I don't want to die and I don't want to kill the people around me. I just want to stop this pain. Because there's so many symptoms that were going on and I just couldn't understand what it was. But luckily, through all the PT, through OT, through all that kind of different therapies that I got, I did get relief. And luckily, in May of 2015, I graduated from the program, and I was symptom-free. Then, with my luck, in June 2016, I got another documented concussion at work from restraining a kid. This time, though, it wasn't a bad concussion. It was mild in regards for me. And I was back to work in no time. My symptoms weren't bad at all, so I was good to go. Oh, that happened twice. And then in February of 2018, actually on the same day as my concussion, in February 2014, I was walking up the stairs and I fell. I did not hit my head, and I immediately felt off. That night, I actually had an anxiety attack. I did not correlate the two. I took off to work the next day because I felt off. And then the following day, I went to work, and I was complaining about the lights. I was complaining about the noise. I had someone check my eyes because my eyes will skip when I have a concussion, and I immediately got nauseous. So I was like, I think I have a concussion. So I went to the ER, and at this point, I was also working in a brain injury facility, in a residential facility for adults with traumatic brain injury. So I also was very well aware of kind of brain injuries too, and knowledge and education around this as well. So I went to the ER, and I was telling the nurse my symptoms, and she's like, no, you cannot have a brain injury. You did not hit your head. I was like, I have a brain injury. I didn't hit my head, but you can still get a concussion this way. And we argued and so forth, and she said I did not. And the doctor came in and said, oh, you have a concussion. I said, thank you very much for telling me this. And this kind of was a journey as well. I ended up seeing a therapist at this time who was a LCSW, because I needed some kind of assistance because I was struggling. And I knew from my major concussion in 2014 that I needed that support to kind of get me through this. And probably about 15 minutes or so at the end of the session, she goes, so I think I'm going to diagnose you bipolar. And I said, excuse me? And she was like, yeah, bipolar. And I said, no, I have a concussion. And she says, yeah, but I think you're bipolar. And I said, no, I'm not. I said, do you understand what a concussion is? She goes, yeah, but that doesn't matter. And I tried to educate her, and she completely would not listen to me, and she wouldn't even have a conversation about that, which really kind of got me so agitated even more because I wanted to educate her about this. And I called a couple people talking about this, and we kind of talked it over. But going back to my concussion last year, I was completely out of work. So I couldn't do things that I normally do. So I'm really big into fitness. So I do CrossFit. So I couldn't basically walk. I couldn't walk in a straight line. I couldn't lift weights. I couldn't cook. I really couldn't even drive. I pretty much felt hopeless, useless. I was relying on my husband for everything. I'm a very independent person, which was really hard for me. I just didn't know what to do with myself. But I knew that once I got the right therapy, things were going to be okay. And it was more my husband that was struggling during this time because he didn't know what to do and he didn't know how to help me. And I was like, it's going to be okay. Once I go to Good Shepherd and once I get the therapies that I need, things will be okay. And he's just like, are you sure? I'm like, it's going to be okay. I promise you. I did get in to see my doctor, and he didn't believe me that I had a concussion, of course. He's like, oh, you look fine. And he started giving me the tests. And one of the assessments, one of the COG assessments that we do is you have to spell the word world backwards. You think about it and you're like, world. Okay. But when you have a concussion, spelling that word backwards is so hard. And I'm trying to spell it. And he said, try. I'm like, I'm trying. And he's like, oh, okay. Or the other COG assessment that they do is a quick one is they do 100 minus 7, minus 7, minus 7. And when you have a concussion, doing that is nearly impossible, and it can create so many mixed feelings for you. And I immediately broke down and started crying because I couldn't do that. So I immediately got into PT, I got into vision therapy, and I got into COG therapy. For my COG therapy, I was in the 8th percentile, which was really hard for me because I was co-running a brain injury unit, and now I couldn't function. But through kind of therapies and so forth, and kind of just having the support from some friends and some family, I was able to kind of get back to my normal functioning. And I kind of got a dream job. I then was running a mental health outpatient clinic. I was supervising 15 staff. We had about 500 clients, so it was pretty awesome. I got that job in June. And the next thing you know, in November, right before Thanksgiving, my 130-pound dog hit me in the face, and I got a concussion from that. So this now, from November to, believe it or not, last Thursday, has been a journey for me. And I say a journey because it's been a journey. And I really kind of want to talk about that because it was a really dark place for me. And it's not that I was suicidal and I didn't want to kill myself, but I couldn't work. I had to leave my job because I couldn't do that anymore. I could not multitask. I could not supervise staff. I could not handle kind of all those activities that a supervisor could do. And I had to go back to a job being a therapist, which is okay, but I could barely do that and I could barely function. So going to work and working and just working from a school day from 9 o'clock to 3 o'clock was near impossible because come noon I needed a nap and I couldn't even remember things that I did after 12, let alone do my documentation and so forth. So it was really hard for me. And I did schedule and I went to my doctor's on Thursday and I kind of was breaking down and I was saying, I just want to get better. I just want to work. I just want to be able to feel normal again. And they did do a suicide assessment on me. And I'm sharing this with you because it is so important because people with concussions are going through so much and they present normal because I finally kind of shared with my husband everything that I've been going through. I said, I've been in a really dark place. He said, but you presented normal. I said, I have because I want you to think that I'm okay. And I really wasn't. And it's not that I wanted to harm myself or kill myself in any sort of way. I just want to feel better. I just want my health back, and I want to be able to be active again, and I want to be able to do what I love. So luckily for me, they actually prescribed me a medication for my fatigue. And since Friday, I've been hiking and running and doing everything again. So it's super exciting. So I think it was really important for you guys just to hear a little bit about my journey to put it in perspective for you guys, because I am a social worker with my master's degree, and I sometimes feel like, oh my God, what am I supposed to do? Because I bet you are dealing with clients all the time that you don't even recognize that they have a concussion, and you think, oh, it's their anxiety, oh, it's their depression, but maybe really it's an underlying concussion that's kind of going on. Okay, so I kind of want to go through this for you guys, because I think it's kind of crazy but kind of cool. So these are some of my symptoms, and I'm going to rattle them off for you. So nausea, migraines, anxiety, depression, agitation, fatigue, brain fog, apathy, poor concentration, memory disturbances, balance disturbances, mood swings, light sensitivity, noise sensitivity, impulsivity, suicide thoughts, sleep disturbances. And I think for this, it's crazy because at some days, all these are going on at one time. And other days, I could be in the best mood. And, like, for example, me and my husband were in the kitchen the one day, and I told him to move. He didn't move. And then all of a sudden, this, like, devil voice comes out of me, and I'm like, what did I just say? And I'm screaming at him, and he's looking at me like, where did that just come from? So these mood swings. And it's important to note that there was a little bit of anxiety in me when I was a child, but nothing to the point that would have been diagnosed as clinical anxiety or depression when I was a child as well. And I believe at this time we were going to open it up for if there were any questions too.
Thank you, Kayla. There were a few questions that we've got in the roster. The first question we had was regarding wanting clarification on a couple of the acronyms you used, like PT and OT.
Yep. So PT is physical therapy and OT is occupational therapy.
Okay. Did you use one that was T like Tom, TT?
No.
No, it may have just heard PT when it was that was supposed to be PT. Okay. All right. It's the second question we got. Someone mentioned it sounded like that you may be more prone to concussions. Are people who get a concussion previously more prone to getting a second or a third one, or is your case more unique?
So this is something that I do talk to my doctor about because I am curious and I always ask him numerous questions. And he did say that once you do get one concussion, you are more susceptible to get another concussion. And especially too, he says, right within like a week, you really have to be careful within that week period of getting a concussion because then there can be more damage done within that week period as well.
Okay. Regarding the quick concussion assessment, are people allowed to solve that problem on paper? The one where you took subtracted 7 all of those times from 100?
I wish.
Do they? Okay, so it's mental processing only, not on paper.
Yeah, so it's all mental processing, which is like, it's really daunting and very stressful.
All right. They also wanted you to restate the condition that you were diagnosed with again.
Yep, it's called post-concussive syndrome, and I'm actually going to talk about that a little bit more.
Okay, wonderful. And then finally, we've actually had a couple of questions about whether the slides that are being used will be shared. And I remember we talked about this yesterday, and you said you were willing to share them. So
Yeah.
We'll send those out with the survey link following the presentation.
Yes, of course.
Okay, that's all the questions for right now.
And can you guys see my face?
We can.
Okay. I was just wondering because I can't see
At least I can.
Perfect. Thank you so much. Right. All right, here we go. So we're gonna talk about now some concussion. So a concussion is a direct blow or jolt to the head, face, or neck or body that is caused for the brain to shift rapidly back and forth, so also known as coup contra coup. It's also important to note that you do not have to hit your head to get a concussion. I'm going to say that again. You do not have to hit your head to get a concussion. You will have many medical providers say you do. My doctor, he is very good. He works at Good Shepherd. It's a very well-known brain injury facility, and him and I debate this constantly, and he wishes there were more education in the medical just world in regards to this because he kind of struggles with this piece as well. So we're going to kind of talk about the concussion 101. So each year, more than 3.8 million people experience some form of traumatic brain injury, also known as a TBI. Only 1 in 6 concussions are diagnosed, and 85% of people with a mild TBI have no long-term symptoms. However, 15% of people with mild TBI have lingering or long-term symptoms. And many people don't realize they have sustained a traumatic brain injury. There is some research that I didn't put in here that I have found previously where it talked about individuals going into inpatient hospitalization thinking that they're going crazy, where really, after doing further research and asking questions, that they sustained a concussion or had some sort of brain injury, where really they were suicidal, but really the underlying contributing factor was the concussion. And once that was kind of treated, the other symptoms subsided. So now we're going to kind of go over the different kind of symptoms: the physical, the emotional, and the cognitive. So, and this is just some examples, and it's really important to note, and I kind of like to talk about it like fingerprints. So brain injuries and concussions or post-concussive symptoms are like fingerprints. No two are alike. They're not the same in any way, shape, or form, and all the ones I have sustained are completely different than the rest, okay? So some physical symptoms that someone may experience could be headache, fatigue, low energy, sleep disturbances, nausea, vision changes, dizziness, balance problems, light or noise sensitivity. Some emotional disturbances could be low frustration, irritability, increased emotions, depression, anxiety, personality changes. And then also the cognitive could be the slow thinking, the mental fog, the poor concentration, distractibility, trouble with learning, memory, disorganization, problem solving, or the issue with the multitasking. Post-concussive syndrome, I know this is kind of what you guys are like, what is this? So this is really interesting, and also there's a lot of kind of back and forth literature, kind of like, is this real, is this not real in the medical field, and so forth. So basically, it's a persistent concussive-like symptoms that develop after traumatic brain injury. And the symptoms typically start within a few days after the head injury and can last several months. And then 15% of patients will have symptoms will last up to 1 year and possible up to beyond. I have asked my doctor this. If someone who has sustained a brain injury or a concussion, let's say 15 years ago, and never got treatment, and let's say would go in and see him and would get some type of therapy, if they would get any type of relief from that. And he said he did have a couple of people who sustained pretty severe concussions like 30 years ago, came in for physical therapy, occupational therapy, vision therapy, and they did get a lot of relief from it. So there is hope that you can still kind of get relief from therapies and so forth. And then also some kind of factors that can also increase the likelihood of developing post-concussive syndrome, being female, older age, low socioeconomic status, history of headaches or prior traumatic brain injury, and history of psychiatric illness such as depression or anxiety. It's also really important to note that if you are working with someone who does have any kind of mental health, and they get, even if it's just a little bit, even if they have like a little bit of anxiety or a little bit of worry, and they get a concussion or traumatic brain injury, this will be exacerbated greatly. That they don't even probably understand where this is coming from. It's crazy how the neuroreceptors in the brain kind of work with this and with the concussions and so forth. Treatment. So treatment is very interesting. It must be individualized. There cannot be a one fit all. It has to be individualized, anywhere from physical therapist, occupational therapist, speech therapist, neuropsychologist, mental health professionals, neuro-ophthalmologist, chiropractic. I really want to say for mental health, especially social workers, if you do not feel comfortable working with someone with a concussion or a brain injury, do some research, reach out to someone or refer out, just because you might do more harm than good. Just from my own experience, I reached out to a fellow social worker who's on this call right now, and I was crying to her and freaking out, and she kind of had a calm, we talked, and she calmed me down, and she was like, no, that's not you, Kayla, like, it's okay, and not everyone's lucky to have those supports. So we really want to make sure that we're treating our clients kind of with this respect and dignity too, and be aware of kind of our scope of practice and so forth. So kind of what we can do with the treatment and so forth, to another kind of treatment option could be yoga, which for people who could be active, it's something too, when you're used to being active and all of a sudden you get a concussion, you're like, what do? I can't walk, I can't lift weights, I can't do this, I can't do that. But doing like a gentle yoga practice can kind of offer that cognitive, physical, and emotional kind of healing and making you feel like you're doing something. I know for me, I was doing CrossFit at that time where I was deadlifting like 250 pounds, and I was running miles at a time, and I was doing all this, and all of a sudden, like, I'm taking a gentle yoga class with 80-year-old ladies that my husband had to drive me to and pick me up, and I couldn't close my eyes when I was seated because I would fall over. So like, it was a way for me to still feel like a sense like I was doing something. And it's a way to kind of improve the quality of life and kind of reduce the symptoms. And also here, it's really important to note this thing here. It's called Love Your Brain Yoga. It's absolutely amazing. I want you guys to look this up then. It's a nonprofit organization, and it's all over the United States. And there was a pro snowboarder who got into a really horrific accident right before the Olympics, and he could not snowboard anymore. And they were like, don't you dare ever get on this, don't you ever basically go snowboarding again or you could die. And he kind of got healing through yoga. And he developed this nonprofit, and anyone who is a caregiver or someone who's experienced a traumatic brain injury or a concussion can go through, I believe, an 8-week yoga series that is basically brain injury informed. And it's kind of like a sense of community and healing for individuals, and it's free. And you can find out kind of where it is in your area, and you can suggest for people to go to this. and so forth, which is very, very cool. I'm sure we all do biopsychosocial assessments because they're super important, but I'm sure most of us, because I know most of the agencies that I've worked in, they have never once talked about head injuries or concussions. And I can say at a place that I worked prior, we would do walk-in assessments for individuals who were in crisis and for adults for hospitalizations. And I had a lady walk in who was in severe crisis saying that she needed to be hospitalized. It was the 1-year anniversary of her husband's death. He died in a car accident. She recently got into a car accident, so she thought she was triggered. She was talking about all this anxiety, and she said how she got into a car accident. She was fine. Her MRI came back fine. And she kind of presented really manic, very disheveled. And I was with her probably for an hour and a half, and I maybe got in 5 words in that hour and a half, and I finally was able to stop her. And I was able to administer a cognitive assessment on her. And I told her, hey, I think you have a concussion. I said, I'm not a medical doctor, but I want you to go to this place to get checked out. And of course she did. Luckily she listened to me because she didn't have any plan. There was no intent to harm herself at all. But she just thought that's what she needed. And of course luckily she listened to my recommendations, and she went to see that doctor, and she came back and she hugged me a couple of days later, and she's like, I can't believe, she goes, I have a concussion. And she kind of went through the process of occupational therapy, physical therapy. They took her driver's license away because of kind of what she was going through because her vision was so bad. So when we're doing biopsychosocial assessments, it's so important to remember the brain is part of that as well in the healing process. So things that we can include in these biopsychosocial assessments are, have you ever been hit in the head? It's such a simple question. Have you ever been hit in the head? Yes, no. No, perfect, you can move on. Have you ever lost consciousness? Have you ever had a concussion? It could be simple. Have you ever gone to the hospital for anything? It's an easy way to remember. Did you play contact sports? That might help people remember too. Oh yeah, I played football. It's also important to remember that there is some kind of research too that does say anytime you see stars, that is considered a concussion. So sometimes too, for people who do karate or in boxing, anytime they see those stars, or even football players, there's even some research too about soccer players and heading the ball and them seeing stars. Those are considered mini concussions, and those adding up as well. Those need to be kind of being mindful of. Have you ever been in a car accident? That whiplash, there is correlations between the whiplash, the neck, and the eye movements. Have you ever been in a physical fight or a victim of violence? This is something too, where we had a lady when I was at that outpatient clinic. She was diagnosed borderline, and I'm sure we all have our borderlines that we've worked with. And I was lucky enough to have a session with her the one day, and we were talking, and out of nowhere she mentioned that she was in a domestic violence relationship for about 20 years. And she started talking about how her partner would beat her on the head and have these contusions in the head, and she would be in the hospital. And I was like, did you ever get a concussion? She was like, no. And I was like, but you got hit in the head? And she's like, yeah, this is like in the 80s. And it makes you think, like, how many of these like individuals who are in domestic violence relationships potentially could have brain injuries or concussions that we're unaware of. Okay. Are you a veteran? Were you ever injured in service? I do think this is one population we are very well aware of. It's kind of the other ones above that we kind of miss at times. And the other part and thing that I have bolded is it's really important to determine the pre-injury functioning. So for example, you can take a look at myself. So I have someone, my pre-injury functioning was I was going for a master's degree, so I was pretty high functioning. I was able to multitask. I was pretty high level cognitively. Physically, I was physically fit. I was able to multitask. I was able to do numerous things because then we want to make sure then I get, in regards to where I'm at, get back to where I am. However, if you're working with someone who has maybe a high school diploma, who kind of works 30 hours a week, has low motivation. You're not going to obviously increase their motivation when you're working with them. So you kind of want to be mindful of kind of where they're at, and make sure when you're doing this with them as well, because it's really, really important, because they're still a person and they might not be able to kind of express themselves during this time, but you can always ask kind of people who are with them. You can always bring in family members, friends, partners, whoever might kind of be able to identify, like, who was this person? Like, who were you before? Because they'll be able to kind of share that information with you. Or even when I worked in the brain injury facility, there was a guy, he was 40 years old, and he was hit by a car when he was 14. Granted, he looked like a 40-year-old man, but he was in a 14-year-old mindset. And you could ask him what he did when he was 14. I would ride my bicycle every single day and and you can know what he did when he was 14 years old. So it's really important to know who are you, what do you do, to be able to kind of work to this person's potential, and so forth. Should we open up for some questions? Are there any questions?
There are several questions, Kayla. All right. The first question is, what do you suggest for a client who has had no relief from the interventions or medications for a concussion? In this situation, it's been almost a year since the concussion, and they're still having terrible headaches. And she wanted to know if this was normal.
I would be interested to know if they're doing vision therapy.
Okay, so that would be one suggestion. Mm-hmm.
Yeah, that would be my biggest suggestion, because there's a lot of correlation with the eyes, which, like, you want to think about, like, you guys hit in the head, how does that affect your eyes? And also the neck. So there's a lot of correlation with trigger point injections in your neck affecting, so I had concussion glasses and I'm not wearing right now. So there's a lot of correlation going on right now in the medical world with kind of neck, and eyes and concussions. So I have something called a midline shift where my one eye is up a little bit. So I don't know if I'm doing it now, probably, where my head tilts a little bit to make up for my other eye. And wearing the glasses and vision therapy assists with balancing them out. So sometimes that helps with, like, the headaches and stuff.
Great, thank you. The next question says, Kayla, I'm so sorry for your difficulties and disappointed to hear about the LCSW's response and refusal to listen to you. Her question was, would you mind sharing what medication you've been prescribed for the fatigue specifically?
I really don't remember, but I don't. All I know is it's used for MS patients for their fatigue. And it starts with an A. Okay. That's all I remember right now. It's the brain fog.
Fantastic. Another question is that, wow, first of all, you rock. You're a perfect example of self-advocacy, and they commented on the courage that it takes for you to share your story with us. What do you wish were different in care of head trauma that might not be usable yet, but maybe on the horizon?
I think it's education and advocacy. I think education in every level, from parents in regards to young children in sports, all the way up to doctors and insurance companies. Because, for example, with my insurance, I would only get 20 visits with PT, plus they want to charge me $35 a visit. Unfortunately, I need more than that. And I don't know if I can afford that much money to cover it. So I think it's a greater issue, because it's not just a quick fix. And I think people need to understand that it's not just like oh, you broke your leg, perfect. It's okay, we need to try all these different things to kind of make it work. And it's the long haul. There's no quick fix for it. And unfortunately, people don't like long haul stuff.
All right. Another question was, do most concussions show up on a scan, or are the scans done to confirm a diagnosis?
No. So no, in my experience, and just in talking with my doctor too, no MRIs or CAT scans will show up. They all come back negative. However, there was some testing being done, I believe in Europe with hockey players with doing blood testing. That's not over here yet, and I don't know if that's going to be like FDA approved or not.
They also wanted to know, what is the best practice or treatment for someone who had a diagnosed concussion years ago but did not have support at the time?
I would say there's probably a lot of resentment and feelings of isolation and loneliness. So you'd probably have to work through that stuff as well, and there's probably a lot of cutoffs that have happened and occurred from that. So you would probably have to bring in some family therapy and bring everyone together to do some education around concussions in regards to the mental health piece of it, to get everyone to understand that it's not that person, but kind of the mental health, like the mood swings, the agitation, the anger, and how that kind of took over that person.
Okay. All right. We actually have several more questions on the site, but I'm in the interest of keeping the presentation going. I'm going to take two. I'm going to ask you two more now. Then we'll see how many we've got at the end, and then I know you're willing to follow up with people who still have questions over email or. Fantastic. All right, so the two more questions right now. One, do you have any suggestions for the diagnosis of concussion in children?
There's so much to talk about in that. It really goes in regards to schools. You can look up brain waves. I believe it's called brain waves. They do a lot of education in regards to the school system and IEPs and 504 plans. But unfortunately, I work in schools, and the schools just aren't educated. And that's a whole nother topic. And obviously, that gets me really frustrated because I'll be in rooms with guidance counselors and teachers like, oh, they're faking it. And then I obviously start boiling and steaming and need to try to educate them. That's like a whole dinner conversation that I could have with that person.
And then in a very connected question, they wanted to know more about physical abuse, child abuse on kids and traumatic brain injury. And was there any comments you had or any research that you were aware of in that area?
Yeah, so that's another one which I actually had experienced, not myself, but a client. A mom came in and was telling me about her son, about how his mood changed and how he was super aggressive and is kind of angry and having suicidal thoughts. And then she's like, oh yeah, my husband was beating him last year and gave him contusions on the head. And I was like, okay. And then luckily I sent her to the same place to get checked out, and I disclosed obviously about my stuff. And she's like, oh, but you look normal. And I was like, yeah, it can happen to anyone. But there is a lot of research, but it's people not being aware of they just automatically think of the physical stuff, like things that you can see. So luckily we are social workers, so we automatically think about the mental health. Now I want to challenge you guys to think about the concussion piece of it. So that's another underlying thing that a lot of people forget about.
All right. That will hold the rest of the questions for afterwards. And thank you so much, Kayla.
Thank you. Okay, so I have this little tool for you guys that you guys can utilize as well. So it's a little post-concussive symptom checklist. I would do this sometimes when I was doing, I would see a client or two when I was supervising the outpatient program who had a concussion, and it was just a nice way for me to know where that client was during that session. Because obviously, if she's rating everything at a 6, do you really think I'm going to have a full entire session with her? No, I'm not. We're going to do something relaxing. I'm probably going to do some kind of meditation with her, some kind of self-care to teach her. We're not going to go super intense into anything because she's not going to get it. And she's not going to be there with you to get it. It's also a nice way, too, for documentation purposes, where if for one day she's rating everything, let's say at a 1, and then she comes into you the next week and she's rating everything, let's say at a 5, you can kind of process, well, what did you do today? And if she's saying that she's like having a horrible day with symptoms, you can kind of backtrack to figure out with her or him kind of what's going on to maybe help decrease those symptoms. Because let's be honest, especially for me, I wanted to get everything done. And luckily I did find a therapist who was a CBIS, she was an LPC, and I'd be like, I'm so tired. And she'd be like, what did you do today? And I'd be like, I did these 10 things. And then I would feel like I was drunk and hungover for about a week later because I would do too much. So she would always say, write down a list and write down your list of 1 being the top thing you have to do and 10 being the least thing you don't have to do. And if you do those 1 or 2 things, that means you accomplished your goal for today. So using this is a really good thing too for your clients, but then also for you and documentation purposes. Okay, so the fun part, TBI and mental health. I'm going to sorry guys, I need to move this a little bit. Okay. So in 2013, a group of Danish scientists found that individuals with a TBI, including concussions, were more than likely to develop kind of these different mental health diagnoses. And there was 1.4 million Danish citizens born between the years of 1977 and 2000. So 65% were more likely to develop schizophrenia, 59% were more than likely to develop depression, and 28% were more likely to develop bipolar disorder. I think the schizophrenia is really kind of interesting, and I only say this because I worked in a facility where it was 12 beds brain injury and 75 beds were mental health, and it was adult residential, and probably about half of the 75 were schizophrenia. And when we were walking around, some of the staff was like, oh, did you know this person had a brain injury? Oh, did you know this person got into a car accident? Oh, did you know this person was in the war and this happened? Oh, did you know this? And it was really interesting hearing about all the different kind of brain injuries that were there with schizophrenia. There was one lady who was completely psychotic. She would say there was the fish in the wall that was talking to her, the dead fish in the wall that was talking to her, the sink that was talking to her. And she got into a car accident, and she was, of course, allergic to all psychotropic medication. And we were wondering that if she was able to be on psychotropic medication, if she would be able to come back to kind of normal functioning or not, which is kind of interesting. So I'd like to point this stuff out. Also, experiencing depressive symptoms after head injury is more common than not. The prevalence of depression after TBI is greater than 50%. Ooh. And people who have received a concussion in the past were 3 times more likely to fall victim to suicide. And I think this is really important. And especially just for myself, and like I said, I'm open to talking about this because I think it's so important to educate and just to advocate. And this is part of my journey and my story, and I want people to hear it. And I'm okay with sharing this kind of stuff now. But I was in a really dark place. I wasn't who I was. I wasn't old Kayla. But now I'm new and improved, and just sometimes I need naps. I mean, that's okay. But you lose friends, you lose family members, you lose jobs, you lose houses, you lose finances. Like, I had to quit a job, not because I was forced to quit, but because I literally could not supervise 15 staff anymore, and manage a 500 patient outpatient clinic. Granted, today I woke up in a great mood and I texted my husband and I said, I want my old job back. I think I can supervise again, which is crazy because 2 weeks ago I couldn't. Like, I'm ready again. And you need to be really aware, and you need to ask those really hard questions to clients and figuring out, are you still doing things that you used to enjoy? And if they say no, well, how are you feeling? Are you thinking about wanting to harm yourself? And I think too that I recently, and I need to do more research on this, about apathy and head injury, that there's a lot of research kind of going on about apathy and head injury and people not wanting to die. It's just more kind of being lost too, and not knowing kind of what to do and being sad and so forth, which is really interesting. Don't quote me and don't ask me questions on apathy because I need to do more research on that. Okay, mental health treatment, because I know this is what we're all about right now. early intervention with psychotherapy, cognitive behavioral therapy, super important because we want to retrain those thought processes. Empowering the individual with related knowledge and education. And TBI can alter a person's mood, behavior, and his or her whole sense of self. Like, it literally changes your whole sense of self, being who you are, what you know, and everything about you. So it's literally like starting from the ground up with like Legos and redefining who you are over and over and over again, and not saying like, I'm never going to be me again. I'm new and improved, or it's okay, I can just do it this way. And for cognitive behavioral therapy, I know the Beck Institute a little while back was looking in regards to like some concussion-based specific cognitive behavioral therapy approaches, which I think would be amazing, and so forth. And there are a lot of neuropsychiatrists as well that do treatment, but I would really love for social workers, LSWs, LCSWs, to kind of be more well-versed kind of in this as well. So for behavioral health challenges, there's mood swings, anxiety, irritability, apathy, and depression, just to name a few. I'm going to talk about anxiety. So the anxiety, like I said, is someone who never had anxiety in their life. All of a sudden they get a concussion, post-concussive syndrome. It goes from 0 all the way to 1,000. And people with brain injury may feel anxious without exactly knowing why. Like, it literally just comes out of nowhere. They may worry and become anxious about making too many mistakes or failing at a task. If they feel that they are being criticized, and many situations can be harder to handle after brain injury and cause anxiety, such as being in too many crowds, being rushed, or adjusting to a sudden change in plan. For example, going grocery shopping. Simple, easy task, right? However, if you are working with somebody and they're like, yeah, I went grocery shopping, and they say it was the hardest thing in my life, you kind of want to explore that. Did they go to a new grocery store? Was the whole new plan layout? Because that happened to me. I went to a new grocery store, and if any of you ever heard of Wegmans before, I went to a different one, and I literally was in the middle of the produce aisle crying because I didn't know where to go. It was overload. There was lights, there was noise, there was people, there was crowds, and I was a mess, and I couldn't figure out where to find the mayo. So it's these anxiety-provoking situations that I never had before. I'm a really outgoing person. And I was having these like super anxiety, like just panic attacks for no reason. So it's really working on how to develop kind of techniques and self-soothing techniques or meditation or anything to kind of work with the individual to kind of relax themselves or not put themselves in the situations. Another example is my family, my husband's family last year on St. Patty's Day, they wanted to go out to eat. And they decided that they wanted to go to an Irish restaurant. And I tried to tell them no, and of course they didn't listen, and we still went there, and I struggled the entire time. Looking back on it, I should have kind of used my voice a little bit more and said, no, I can't go there. So it's helping that person find their voice and to kind of be assertive with their communication as well. And depression, so feeling of sadness, frustration, and loss are also common. It's almost like recycle that you go through with your concussion or post-concussive syndrome, because it's a new way of life, a new change for you. These feelings are often appear during the later stages of recovery after the individual has become more aware of the long-term situation. Symptoms of depression can be feeling sad, worthlessness, changes in sleep or appetite, difficulty concentrating, withdrawal from others, loss of interest or pleasures, feeling of tired, thoughts of suicide or death. And I think it's really important that if you are noticing any of these symptoms in people that you're working with, I think you need to do a suicide assessment. Especially if you're seeing 2 or more, I think those are kind of red flags, because there is something going on that you need to ask and to do your job. Because last week when I went to my doctor at Good Shepherd, they did their job, because I was saying how I was talking about my fatigue. I was feeling worthless. I was feeling sluggish, tired, how I lost interest. And they did suicide assessment on me. It was the first time in my life. And I was like, they just went there. And it was really hard for me to hear that. And granted, I didn't want to end my life, but it was something that I was struggling with. And like I said, it was just kind of eye-opening. that we really need to be aware of this population and to kind of assist them and get them the care and the help that they need. This is a really nice list of resources too for you guys that we'll get to you so you guys can utilize as well. So you have Brainline, so much information in regards to research. They have videos and so forth. Brain Injury Association of America. There's like a PA chapter as well. They do advocacy. They have like meetings and so forth. Brain Steps. You can use this actually for anyone who's working with children. This is what you guys can utilize for the school as well. In regards to 504 IEP plans and so forth, super important because schools do have to assist with this. Center for Disease Control and Prevention, face sheets, tip cards that you can guys use for education. This one right here, the systematic approach, awesome manual, little tool book on what you guys can kind of do, little like tips and tidbits and so forth. Defense of Veterans, perfect. And then the TBI staffing. These are like little modules kind of just on TBI and so forth that you can do. And also a really good one that I'm even a part of is the Facebook Concussion and PCS post-concussive support groups. I participate in them. I think there's like almost 9,000 or 10,000 people in them who literally like post every day, and it's just really supportive to be like, hey, I'm experiencing this, or have you ever tried this, or do you have any suggestions for this, or hey, guess what, I did all this today, yay. So sometimes people don't have that support, and it's really important to notice. You can also find sometimes through Brainline or brain injury support groups. Sometimes those are really helpful as well. And then, sorry. That's really weird. Hi. Is there any questions until I can get my next slide up?
Yeah, we can ask a couple of questions while you're.
It's just my contact slide.
Sure. All right. One question was, were there any precautions that your doctor has suggested to prevent additional concussions?
Don't do anything stupid like skiing, water skiing, stuff like that. I still will be like really active. Like I still do CrossFit, I power lift, I do yoga. It's just, you have to live your life, but you still have to live your life.
Mm-hmm. All right. Were there any suggestions about where a client could go to receive vision therapy?
I believe there's like an occupation. Hold on, let me think of the name of it. If you type in like vision therapy, I'm sure in Google you can probably find local places that do it. Like in the Lehigh Valley, like Allentown area, Good Shepherd's where I recommend, but I know this is everywhere throughout Pennsylvania. If you want to email me, I would be more than happy to assist in kind of finding a place and even kind of using some contacts that I have and kind of finding a reputable place as well. I know Dr. Becker in Wilkes-Barre. I used to drive up to Wilkes-Barre and see him. He's pretty amazing too. But like I said, contact me and I can also help you find somewhere for them.
Okay. We only have a couple of minutes left, so we'll cram as many questions as we can in that period. One person noted that you've presented with considerable insight regarding your own TBI and the related symptoms, but noting that insight can vacillate or vary. And did you have any suggestions regarding helping clients with accepting their own situation, understanding, and participating in their own identification and recovery?
So for that, I believe it's kind of almost going through the it's almost, I believe, going through the grief process of yourself. And depending on kind of your functioning and figuring out kind of things that you value. Like for me, like I used to love skiing and so forth, but now I know I can't do that because of safety reasons. So it's helping them identify their values, things that how they would rate, things that they want to kind of keep in their life, things that they don't want to keep in their life, and kind of working on that process with them. And also the support systems as well, and using family or friends or partners in there, I think is huge part of that process too.
Wonderful. Well, that's a great note to close on. And I will note again for our audience, the evaluation link has been posted in the chat and will be emailed out. Obviously, you have Kayla's email address to send her any additional questions or notes. And a reminder that after you fill out that survey with the evaluation, that it will take a couple of days for you to receive your certificates. But join me in thanking Kayla Schubert-Worth for sharing her story. That was a fantastic presentation, and thank you so much.
Thank you, guys. Have a great day.